Hi everyone, this is Dr. Schroeder with this week's video introduction to week number 4 of our course in the Principles of Healthcare Research. Once again, a very good week of discussion. In week number 3, the primary focus was to go back and look at these same two articles that we've been reviewing in much of the course. The Beck article that was the qualitative study on PTSD in women who experience childbirth trauma, and the Kokalba study on the efficacy of hand massage, the quantitative study. And the primary task was to talk about the hypotheses and the research questions and what was the stated significance to nursing. And a few things that I want to point out. One is that when we talk about the significance to nursing, a lot of times with novice researchers or people that don't really understand the process of research, they'll look at a study and review it and to say, well, this is really such a small little study and there was nothing found that was really significant about it. So what's the significance? It's kind of easy to look at the Kokalpa study and say that it's an insignificant study. It had a very small study population. It found that it had no real, meaningful outcomes in the sense that there was no significance found that hand massage increases comforts in these patients. So it's easy to kind of think, well, we just toss it aside and it's not really an important study. Where in reality, even small studies like that are really important because you can take a small study and you compare it with what does the body of the literature say? What does the body of the literature say about comfort or about hand massage or other types of interventions with different populations of patients. And so when you look at the body of research, no one study is really all that important. Um, Sometimes it is those small little studies that really lead to big conclusions, or they become the piece of evidence that really becomes very important. And also, the other thing that was pointed out by several of you and is very correct is that a qualitative study does not generally have a hypothesis. Matter of fact, a qualitative study, just a straight qualitative study, will never have a hypothesis. A hypothesis is a statement of what you think you're going to find. In a qualitative research, you never really know what you're going to find. That's the whole point, is you're trying to find something new. So you're not going to find a stated hypothesis. Whereas in a quantitative study, you will almost always find either a hypothesis, which is a statement of what you think you're going to find, and contrasted with what's called a null hypothesis, which is the opposite of what you think you're going to find. The reason that we have those two hypotheses written that kind of mirror each other, sort of as opposites, is because statistically we're trying to support one hypothesis or another. So that's why you'll see this hypothesis and then what we call the null hypothesis, which is essentially a statement that no significance will be found. And that is shown statistically through statistical analysis. So those are really the big takeaways this week. In week number 4, we're going to shift our focus a little bit, and we're going to be talking about the different types of research design. And so for this, we're going to be looking at a different study. And this is a topic that some of you have mentioned before as being something that you feel is something that is significant. So we're going to be looking at hospital nurse staffing and patient mortality. And so we're going to be looking at the Aiken study, the Aiken et al. Study, a very wide-ranging study, a little bit different than the studies that we've been looking at. We're going to talk about if the research design was appropriate. Was the research question clear? And how were the variables controlled for us? We're going to be talking about that and shifting our focus a little bit here. Also in week number 4, remember you have your midterm examination due. This examination is open now. It will be open from now until Sunday night, so you want to make sure you leave yourself time to go in and take that. It's a 50-point multiple choice examination. You have 100 minutes to complete the exam. It is a one-time thing, so you only get to go in and take it the one time, so use the study guide. Try to do the best job you can to answer the questions as completely as possible, because there's not really enough time once you're in the test itself to make it an open book test. You really do have to have a little bit of, do your study beforehand, because there's not enough time to really go back and look up a lot of questions while you're in it. So that's primarily what we're doing this week. And then also you're going to have a quantitative research critique that's going to be due next week. You really should start to look at this now. This is the research critiques that you're going to do for this course are, it's easy to look at them and think that they're not going to take that long, but they take quite a bit of time to complete. So you want to go ahead and take a look at that. I'll be talking about it more specifically next week in the introduction, but you want to look at that and see what the criteria for that is so that you can get a start on it this week. So that's pretty much it. I have posted some information also on the difference between type 1 and type 2 errors. That is something I received a question on, and it's a question that comes up fairly commonly or fairly frequently, because it's one of those things that is sometimes hard to get your head around a little bit. And so I've tried to post some information on that in the Ask Your Instructor thread. If you have any other questions, please feel free to let me know. I look forward to seeing you in class. I look forward to participating in the discussions with you. Look for your grading for the discussion questions this week to be done by probably about midweek this week, no later than Friday for sure. And I'll see you in the discussion forums.